Hi everyone, it is a great pleasure to be speaking to you about digital literacy. Now, when we talk about digital literacy, lots of people have different definitions for it, but here at HEE, we have defined digital literacy as the capabilities that fit someone for living, working, learning, participating, and thriving in a digital society. Now, whilst we would like to think that our millennials are digitally literate, this definition does tell us otherwise. Now, why is it important for us to think about digital literacy for our health and care workforce? Because it is a real challenge when we think about digital literacies of our health and care workforce. We have got 3.1 million staff within health and social care who have wide-ranging roles, different skills and ability levels. Individual attitudes to learning and addressing learning needs are different as well. And then there are the organizational differences as well, training cultures, how commission is training, and certainly the issue around patient and citizens' education is critical to us being able to support our workforce with their digital literacy skills. What does the evidence tell us? We do know that the type of changes that we are seeing, certainly within health, is really phenomenal. And the scale at which these changes are happening is quite great. So in 2018, McKinsey did a piece of work around 5 industries and understanding the scale of digital literacy or skills needs. And health was the area that needed digital skills the most, or certainly for now and in the future. And we do know that the rate of change is much faster than our ability to adapt to these changes. We also know from self-reported digital skills by professionals that the picture is mixed. There are a number of reasons why that is, depending on which professional group, the level of skill or responsibility, you will get a different picture as to how people rate themselves. Having said that, there are a number of barriers that our staff have identified as stopping them from A, acquiring digital skills, but B, also embedding those skills within their practice. And those 3 barriers really are around attitudes and behaviors in the workplace. And these barriers can be categorized into training, infrastructure, and organizational culture, which are the main areas that prevent people from really acquiring or embedding digital skills in their workplace. Now, we do know from the evidence, certainly recently through the COVID-19 pandemic, that it is important for our staff to have the digital skills that they need to be able to provide effective care, not to mention choice for our citizens and patients. Certainly within HE as well, there are a number of policy drivers looking at our own NHS long-term plan, our people plan, and certainly the total review, which highlight the significant need for a digital-ready workforce. So when we talk about digital-ready workforce or digital readiness, basically we are talking about adaptability. So having a digitally ready workforce is not just about the ability, but the willingness as well. And looking at people's willingness is around individual attitudes to digital and how we embrace that. But also there are organizational cultures, and it's about the cultures that we establish within organizations to allow the workforce to really embed digital in everything they do. Having said that, we definitely do need to think about skills for everyone, but also the technology, and to think about skills for specialist workforce, including our informatician workforce. So within HE, we are taking a number of approaches to develop the digital skills of our health and care workforce. Now, these approaches are outlined here. So it's about defining digital literacy. As I highlighted earlier, the word digital literacy means different things to different people. So for us, it's important that we define that. But more importantly, is to be able to support our workforce to be able to assess the needs. It is also about not just our current workforce, but it's about our future workforce, because if we do not do anything about the literacies and the digital capabilities of the workforce that we are training now, we will need a lot of catching up to do. And we will never get to the point where we have got a sufficiently digitally literate workforce. It is really about specific workforce areas or professional areas as well, because the evidence tells us that digital literacy can sometimes be context specific. So it is important for us to understand whether there are indeed any differences between specific workforce areas or specific professions in terms of the digital skills that needs to be acquired. We are also looking at championships and pioneers. So certainly when we did a discovery on digital literacy, we identified 3 groups of people from there: the digitally engaged, the digitally negative, and the digitally ambivalent. So as the list goes, it is evident that if people are digitally negative or indeed ambivalent, there might sometimes be the need to have people that support and drive them into beginning to embrace the digital agenda, and hence the need for digital championship and pioneers, which we do know from evidence as well that it does support local ownership and certainly further digital skills development. Again, what are we doing at HE to really support the workforce in developing digital literacy? It is about understanding what learning resources are there. Rather than reinventing the wheel, we are looking at how we can utilize digital skills learning that's already in the system. And that means curating those learning to ensure that it is fit for purpose for our workforce. And indeed, where there are gaps, be able to commission more learning to allow individuals to access digital skills learning. Now, to do this, I guess historically, we have been used to going on mandatory training or being given a whole raft of learning. But we do know that certainly a lot of our frontline clinicians haven't got the gift of time to be able to sift through the significant amount of learning that's there. So we're really keen to invest or at least test some signposting technology and tools to understand whether we are able to provide learning at the time of need in the way that people consume it that's appropriate for them. Now, to enable us to do a lot of this work, HE developed a health and care digital capabilities framework in 2018. And as you can see on the screen, there are 6 domains. I mean, predominantly the 5 domains from technical proficiency to communication, collaboration, and participation are the main domains, with an overarching domain around digital identity, well-being, safety, and security. Now, the 6th domain, which is in the identity domain, really is an overarching one for all 5, because you cannot think about information, data, and content capabilities without necessarily thinking about how you maintain your safety and security online, how you manage information and data, and how you manage content. And I think more importantly, our digital well-being has become quite critical as we are working from home and spending a lot more time on screens. Now, once this capability framework was developed, it became really apparent quickly that we needed an interactive tool to allow individuals to self-assess their own digital capabilities and be able to provide information for our senior leaders to be able to plan digital skills and learning needs for their workforce. So how have we done that? We have developed a self-assessment diagnostic tool looking at the 6 domains that I highlighted in the previous slide to really allow the individual to gauge where their skills are and also to think about within their current role where they need to be. We all do know sometimes that actually, whilst I am operating at this level, to be more effective, I do need additional skills. So I will show you a few screenshots of what the self-assessment diagnostic tool looks like, which is currently being tested within HE before we slowly roll it out within the wider system. So you start off with, all 6 domains will have questions in there to test where you are now and where you need to be. But it will definitely be focused within your role, your current role. Now, once you have completed the questions in all 6 domains, it is about reviewing those digital skills, because as you answer these questions, you get to the point where you review it and think, oh, actually, my average scores are much lower or higher than I anticipated it to be, which gives you an opportunity to readjust those scores. And then once you have completed the whole assessment, you can check through your answers to ensure that you are comfortable and happy with where the scores are. This then takes it to a signposting tool, which is provided by a third party, which we are testing, as I mentioned earlier, to understand whether personalizing learning supports engagement of our workforce taking up digital skills. It would be very much around you being able to be signposted to learning that's relevant for you. So based on the questions and answers you would have provided previously, the tool then gets an overall profile of your digital skills gaps or learning needs, and be able to make recommendations, as you can see to the left-hand side of the slide, that it will initially make recommendations for you, but subsequent to that, allow you to think about other areas of digital skills learning that you can engage with. It is very important, whilst we think about the individual digital skills needs of our workforce, to think about creating environment and organizations to really support and foster the development of these digital skills. For any organization to be effective in doing that, it needs to think about 3 things. It needs to think about its people. It's about planning for not just now, but for the future. We have seen how rapidly we've had to do lots of things in this COVID period. It is about the culture. So the openness, the experimentation, is the sharing of power, and is really supporting everybody at every level to take on the leadership thinking, the leadership mindset that allows them to be able to lead and be able to promote their own change. But more importantly, I think it's about allowing people to make mistakes and learn from them rather fast. So again, as we've mentioned, all of this will not happen if we haven't got staff that are capable. For digital skills to be fully implemented, people need to have not just skills, but they need to have the motivation and the confidence to be able to utilize the skills they've acquired. And it's all about user needs, really. It's putting people at the center of everything we do. Now, the other P is the process. So whilst we are thinking about processes, about understanding processes that facilitates things happening. So keeping it quite light, keeping it, again, user-focused, something that's fast and integrated as well, and really something that facilitates this happening rather than hinders it. We did a piece of work within HE with the Royal College of Nursing, and we had about 900 responses from nursing and informatician workforce. And one of the points raised in there is, and actually, please tell our organizations that when they put things in place, they shouldn't set up processes in terms of policy that actually prevents us from fully utilizing these opportunities. Now, once we have talked and provided enough for our people and processes, technology cannot be ignored. It is very much around understanding the risks and assurances in terms of the technologies we are providing. It is around thinking about the technologies that are scalable. Interoperability is a word that has been used a lot in recent years. It is really about fit for purpose. But I think fundamentally it is about having the right technology for the right people, and more importantly, at the right time. Timing is really critical when it comes to technology. So I will end on this note, and really pleased that my colleague James Freed, who is the Chief Information Officer at Health Education England, will be joining you for the discussion afterwards. Thank you.